Greetings, everyone. So today we are going to discuss about a special topic, EMDR, and effective mode of psychotherapy. So before starting my presentation, I would like to thank Sister Janet Nettasinghe and Mr. Navnet Nanakara and other members of the EMDR Sri Lanka Association for giving me this opportunity. My presentation is mainly based on three of my books. One is EMDR Sri Lankan Experience, and other book is Shell Shock to Palali Syndrome and Clinical Meditation, where I mentioned mentioned using EMDR in clinical settings. So we all know that EMDR, aka eye movement desensitization and reprocessing, it's a clinically proven evidence-based psychotherapeutic method that was developed in 1987 by Dr. Francine Shapiro. So in 2005, after tsunami disaster, a group of doctors, EMDR specialists, came to Sri Lanka and they trained a number of Sri Lankan therapists to in EMDR, and they helped us to provide support services for the tsunami victims. And I had the opportunity of going to Coatesville VA in Philadelphia and undergo residential training under Dr. Susan Rogers. And also I met Dr. Steven Silver, director of the PTSD program. Dr. Susan Rogers and Dr. Steven Silver, they are very successfully using EMDR to treat combat veterans. And this is one of their books, Light in the Heart of Darkness, that narrates the positive therapeutic outcome of the veterans who were treated with EMDR. So this is a very valuable email that was sent in by Dr. Francine Shapiro in 2005. I have still preserved it. So EMDR is a non-drug psychotherapy procedure, and it's cost-effective and seems to have no side effects. This therapeutic approach guided by the adaptive information processing, AIP. So adaptive information processing model is a theory that describes how memories are processed and stored in the brain and how this process can be maladaptive in case of trauma. So I always explain my patients this example. It's a nice analogy. If a person consumes bad food, it's stuck inside his stomach and it causes nausea and vomiting, same as the traumatic memories which are stuck in our system, our brain system, especially memory system in the brain, and it causes a lot of distress and causing anxiety and depression. So with relate to food, either we have to get this food out of our system, we have to flush it. So EMDR similarly does a similar thing. And if I simplify this concept, so this unprocessed memory through EMDR, we can bring it to more resolution, to more processed memory. So what is psychotrauma? Psychological trauma is an emotional response caused by severe distressing events that are outside the normal range of human experiences. So Dr. Francis Shapiro defines big T traumas and small T traumas. Small T traumas we encounter everyday lives in traffic jams and day-to-day encounters with our friends, our family members, etc. But big T traumas, it's beyond our normal human experience. It can cause severe overwhelming distress. So EMDR contains with the theoretical model that emphasizes the brain's information processing system and memories of disturbing experiences as the basis of pathology. So we know that the amygdala, our fear center, and hippocampal region, that's the memory center, is crucial in forming these memories. Especially, you can see the brain showing overactivity. Neurons are firing, and the person is in an emotional turmoil. So after EMDR, you can see the person is more calm, and uh, the, the brain areas after the scanning, you can see it goes into more rational, more resolved phase. Human brain has two hemispheres. Some believe that through eye movements, these two brain hemispheres can be stimulated, and it allows the unprocessed negative information, traumatic memories, triggers, cravings, to process and convert it into processed memories. There are a number of benefits of bilateral stimulation. It activates both brain hemispheres. It synchronizes both brain hemispheres. Also, it stimulates the parasympathetic nervous system, because especially in trauma and PTSD, their sympathetic nervous system is more pronounced, and they have a lot of hyperarousal reactions. So through bilateral stimulation, we can decrease the activity of sympathetic nervous system. And also it increases neurotransmitter activity, gives orients the brain, and facilitates working memory. And bilateral stimulation increases in limbic processing along with decrease of frontal activation. We know that in depression, especially the right prefrontal cortex is more activated. The neurons are highly firing. So with bilateral stimulation, we can decrease the especially the right frontal activation. And also bilateral eye movements bring increased hemispheric interaction. So brain hemispheric synchronization, also known as hemispheric coherence, and also it's very important in brain function. EMDR transforms the dysfunctionally stored experience into an adaptive resolution. This EMDR and bilateral stimulation, actually it's a form of ancient wisdom, especially in the Sri Lankan culture. You can find this thing in Tovilea also. It's an ancient ritual. It's a form of psychodrama, and they use different types of drumming, and that causes a bilateral stimulation. Several years ago in Canada, I took part in Anishinaabe First Nations powwow, and they did this drumming. And I saw it was a healing ceremony, and I saw how it caused the bilateral stimulation, and it was a very, very therapeutic session for everyone. So pathogenic memories create sort of schemas. Schemas are hypothetical. It's a morphological objects. So it's a form of organizations, and it in traumatic memories, it creates schemas in our brains. For instance, you can see this linear schema. We can consider it as a healthy schema, and following a traumatic event, it becomes sort of zigzag. Yeah, I'm just giving example. This is to simplify the underlying process. So once the pathological schema is formed, it causes a lot of psychological distress, and the EMDR is geared to bring these pathological schema into more healthy schema. And also in 2008, I made an hypothesis in my book that EMDR activates natural benzodiazepine receptors in the brain, because in 1979, two researchers, Mohola and Okada, they found natural benzodiazepine receptors in the brain. Uh, and in EMDR, it's being advised that after an EMDR session, better not to give benzodiazepine to the patient. So based on these assumptions, I made an hypothesis that EMDR activates natural benzodiazepine receptors in the brain. And I submitted my idea to Dr. Francine Shapiro, and she concurred that. So still, I think it's not proven via any research, but in the future, maybe within another 5 to 10 years, if you have very sophisticated brain scanning system and to analyze brain chemistry, either we can prove or disprove my hypothesis. EMDR mimics REM sleep. REM sleep is very important because sometimes people, even after 5 to 7 hours sleep, they wake up exhausted because they don't experience REM, rapid eye movement sleep. REM sleep is very important in healing, especially it enhances memory, emotional processing is enhanced, and it's really good for brain health. It replenishes neurotransmitters and enhances immune system, and also it reduces risk of developing dementia and enhances creativity. Here, I would like to bring one example about how Kekule he formed the structure of benzene. He was struggling with the structure, and after that he went to sleep and he had a dream. So Kekude had a dream, and in his sleep he saw the structure of benzene. So he came when he woke up, he came with this structure. So what happens was REM sleep, it enhances our inner thoughts. It uh, gives more creative ability to think and to formulate more positive ideas. We know that the American Psychiatric Association has recognized EMDR as one of the effective and potential methods to treat PTSD. Not only American Psychiatric Association, in Canada, Australia, and even in UK, and also in other countries, EMDR has been recognized as one of the leading modes of treating trauma. I think the major success behind EMDR is it has a number of approaches, like it has client centers, Rogerian mode, and also there's a psychoanalytic Freudian component and cognitive behavior therapy. Mindfulness is very important because EMDR helps to bring the clients into the present moment. Most of these people with depression and anxiety, they live in the past or either in the future. They are in a sort of time pendulum. They time travel. They go back and forth. They go to their past experiences, past negative experiences. Also, they have anticipatory anxiety. They are worried about future. So they time travel. They are not focused to the present moment. The moment they are geared to focus into the present moment, they are in a very safe capsule. No depression, anxiety, or stress can't harm them. I think if you probably you may have read Eckhart Tolle's book, The Power of Now. He emphasizes the importance of being in the present moment. So mindfulness is a very, very powerful, very positively made therapeutic activity, and EMDR reinforces these clients to be in the present moment. And also EMDR has body scan, body-oriented method, and the patients can identify their body They can be aware of body sensation, any painful impulses, and it really works for the pain-related symptoms. I will later explain this. And also interpersonal therapy, rational emotive, that was introduced by the psychologist Albert Elias. We, uh, we, uh, we try to bring negative cognition into positive cognition. It's We are using rational emotive tactics to do that, and having a very friendly mediation. Sometimes we sometimes ask various questions to bring the client into more rational planes. And the DBT component is there, and also exposure therapy. Exposure therapy is very important in phobias, and especially in PTSD. So the success lies with these ingredients. EMDR has been initially used to treat a post-traumatic stress disorder. So large body of research has found that EMDR is one of the efficacious psychotherapeutic methods to treat post-traumatic stress disorder. And EMDR has become the most extensively researched psychotherapy mode today. In 2016, I met Dr. Judith Herman at Harvard University. She invited me to do a lecture for her students. And there I mentioned about the effectiveness of EMDR, especially treating patients in Sri Lanka. And also Professor Judith Herman, she has done a lot of research. She's the one who came with this idea of CPTSD, complex PTSD. Also, Professor Basil van der Kolk, also, he's a believer in EMDR. And I have discussed numerous cases with him. And he agreed that EMDR has very effective therapeutic ability. So I would like to discuss EMDR and PTSD. So what is PTSD? It's an anxiety disorder. Post-traumatic stress disorder is a cluster of psychological symptoms that can follow a psychologically distressing event. And typical symptoms of PTSD occur after recognizable stress or traumatic event that involve intense fear and horror. And PTSD denotes an intense, prolonged, and sometimes delayed reaction. This is very important to know. Sometimes PTSD can cause delayed reactions. Dr. Michael Robertson of Maya Wesley Clinic, he found a delayed reaction after 50 years of the initial trauma. In my clinical practice, I found a patient who had PTSD reaction after 13 years. In 1988, in Sri Lanka, he was exposed to a traumatic event, and after 13 years, he was experiencing flashbacks and intrusive memories and other PTSD symptomatology following this trauma. So there are a number of symptoms of PTSD, hyperarousal symptoms, re-experiencing symptoms, intrusive memories, flashbacks, nightmares, symptoms of avoidance, and emotional numbing, restricted emotions, and alienation. And there are other common symptoms like hostility, guilt, substance abuse, reduced motivation, negative self-image, depression, suicidal thoughts, problems with intimacy, cynicism, frustration, revenge fantasies, resignation. There are a cluster of sub-symptoms, and it affects the patient's functionality. So EMDR is indicated in, as I mentioned, especially in PTSD, depression, chronic pain, fibromyalgia. I have several case studies I would like to mention: phobias, body dysmorphic disorder, eating disorders, social anxiety, post-traumatic embitterment disorder, addictions, generalized anxiety disorder, and OCD. So EMDR and Vietnam War has very close connections because Dr. Francis Shapiro, earlier patients were Vietnam veterans. I met some of the Vietnam veterans at the Coatesville VA who were successfully treated by EMDR. And also I had the opportunity of going to Kalmari O'Neill VA and meeting with Dr. Rajiv Trehan, the director there, and Dr. Mahasen De Silva. And I spoke about my experience about EMDR, and they agreed. They were positive about using EMDR to treat Vietnam veterans and Iraqi veterans. PTSD Sri Lanka is a controversial subject because in the early stages, when we started diagnosing PTSD Sri Lanka, some of the clinicians were skeptical. They thought that PTSD is an American illness, and they thought it's not a very culture defined, but I think they were wrong, and there were ample examples to show that PTSD was there throughout our history. So after this, the 30-year war broke out in Sri Lanka, there were a number of people, combatants, civilians, and paramilitary. They suffered from severe anxiety conditions. And there were a lot of patients with PTSD, but they were, at the initial stage, they were undiagnosed and untreated. This is a famous book written by Ethan Watters. According to him, the title is Crazy Like US, the globalization of the American psyche. According to him, PTSD is an American illness that was exported to other countries and other cultures. But I tried to debunk his theory, and I wrote a research paper indicating that PTSD was in a number of cultures, and even Shakespeare wrote about PTSD. Homer's Iliad and Odyssey describes PTSD type of reactions. And I found a Sri Lankan king who had PTSD type of reactions in 1500s. His behavior was vividly written by a Portuguese historian, Queiroz. So I took those examples, and even in Buddhist Jataka stories, there was a story about a monk who had a mortal fear. He was named Marana Bhiruka Bhikshu, the monk who had mortal fear. So he had severe hyperarousal reaction, and he had intrusive memories, difficulty sleeping, flashbacks, and all sorts of PTSD related symptomatology. So highlighting these factors, I wrote a research paper, and it was published by the US Army Foreign Military Studies Unit. So it gave us some insight and guidance to start and study the PTSD Sri Lankan experience. After the tsunami disaster, there were a lot of PTSD victims. This is one of the patients we treated. So you can see the giant wave. It was the intrusive memory and the flashback. And this was another patient who recalls the dead bodies at Mathura Hospital. In 2008, I published my paper combating tsunami disaster through EMDR, and that was published in the Journal of EMDR Practice and Research. So this is Dr. Nancy Erebo. She helped us a lot, and she is the one who gave us the knowledge and skill in EMDR. So Dr. Nancy Erebo is one of my gurus in EMDR. Also Dr. Susan Rogers. So these are the patients that we successfully treated. So I would like to mention some case studies. This patient, he was a Lance Corporal. He exposed to a landmine explosion, sustained minor injuries, but he witnessed death of his friends. So ever since he had survival guilt, intrusive memories, flashbacks, severe avoidance. And later he was diagnosed with EMDR, and we successfully treated him with, he was diagnosed with PTSD, and we successfully treated him with EMDR. And this is another patient who were treated with EMDR. This is his intrusive memory and flashback about an artillery fire. This patient was a POW for 5.5 years, and for nearly 6 months, he was kept in a small room without light. Here, his tormentor wanted to break his biological clock. At a certain point, he didn't know it was daytime or night. So gradually, he became a walking zombie. So that was a very brutal method to use, extract information from this soldier. And he vividly describes his brutal experience. He was beaten, then he witnessed the torture of other prisoners, the execution of other prisoners, and he was taken several times for mock execution, and vigorously he was interrogated. He was released after the intervention of the ICRC, the Red Cross. Even though he came to the free world, his mind was still hounded by his POW days, and he suffered CPTSD, complex PTSD, and it took nearly 3 years to bring him to more adaptive level, but we couldn't cure him completely, but we were able to reduce his suicidal thoughts, and somewhat we were able to settle his sleep. This is another officer who witnessed the death of 8 soldiers. They perished in front of his eyes following a mortar attack, and he went into acute stress reaction. Then he had PTSD symptoms. He was treated with EMDR, and today he's doing a very productive job. Another soldier who recalls his combat events, he was a tanker, and this is the Operation Ranagosa. This patient was an interrogator, and he used to interrogate people, and also he engaged in torture. So subsequently, he became a PTSD patient. So this shows torture is a double-edged sword. It can hurt the victims as well as the perpetrator. So after a while, he was obsessed with blood, and this is a bleeding skull. Every night he used to see a bleeding skull. Sometimes he was seeing he's in a bloodbath and drowning. So this patient too had CPTSD symptoms. We took special effort to treat him, also medication, psychotherapy. So we combined EMDR, and we were able to achieve some success, but not 100%, I would say. So this is our uncontrolled study with 18 combatants with PTSD. And we had, this study was done in 2005. So among the 18 patients, 12 of them had positive outcome, reduction in nightmares, intrusions, depressive feelings, suicidal thoughts, and they became more functional. And we had 2 failed cases, and there were 3 patients. It was doubtful cases. Either they were malingering or they had some secondary gain. And one patient was, he had a resistance to the therapy. He developed a severe psychophysiological reaction, and after 1 or 2 sessions, he didn't want to undergo EMDR. So out of 18 patients, 12 were successfully treated with EMDR. And EMDR is effective in the treatment of addictions. because in addiction, it forms an addiction memory. It's connected with our brain rewarding system, and it hijacks. We call it uspersion. And once the addiction memory is formed, the person has the drugs seeking behavior. He has also cravings, and it's very difficult to treat people with addiction. And we have several successful cases treated with addiction. This patient I treated in Toronto. He was referred to me by Dr. Elam Nahim, one of the addiction specialists in Toronto. He was treated with Suboxone, despite the fact that he was on Suboxone and he was on antidepressants for long years. He had chronic depression, and he was injecting heroin. When I spoke to him, he had a lot of childhood trauma, a lot of abandonment issues. Then I started treating him with EMDR. Within 8 or 9 sessions, he showed very positive outcome. He gradually stopped injecting heroin, and his depression came down. So I have to make an emphasis that this patient was given SSRIs, antidepressants, for a long years. More than 10 years he was on antidepressants, but still he was experiencing chronic depression because it was his internal depression. His chemical disbalance was treated, but his external depression was not touched, and EMDR did the job. So what at certain after 8 or 9 session, he told me that he did not inject heroin for about 3 weeks. Anyhow, I verified it from Dr. Nahim, who did his urine test, and found that there were no such chemicals in his urine, and we knew that he was telling the truth. So this is a very, very successful case study. A person with addiction, heroin addiction, IV addiction, treated with EMDR. And subsequently, it helped Dr. Nahim to reduce his Suboxone, and gradually he was walking towards drug-free life. And EMDR is very effective in pain management. I remember in 2006, I treated a patient with cancer. He had cancer and cancer-related somatic pain, excruciating pain. Then with EMDR, we were able to reduce his pain-related symptoms. A few years ago, I published a paper with Professor Amy Wachholz, treating mindfulness meditation, mindfulness techniques in fibromyalgia. Actually, using EMDR also gives very, very positive results, because in pain-related symptoms, the patients, they have anticipatory anxiety, frustration, anger, self-pity, anxiety. So if you can cut down these components by using EMDR or mindfulness interventions, you reduce 50%, sometimes 60, 70% of their painful impulses, and reduce their pain. And following EMDR, I have seen prior to EMDR, their pain level was like 9 units. After the session, it drops to sometimes 3 units, 2 units. And there were some patients who were abusing alcohol in order to as a remedy to their pain. So they were in a sort of using negative stress coping method. And once you treat their painful symptoms, their addiction also reduced. And EMDR is very, very effective in treating depressions, especially trauma-related depression. And obviously, EMDR works on trauma very well. So in trauma-induced depression, I would recommend using EMDR. And this case study, it's a very peculiar case study, which this patient, I treated this patient somewhere in 2000, late 2006. This patient was referred to me by Dr. Nee Fernando, consultant psychiatrist working for the military hospital. A soldier's an officer's wife. She was suffering from postpartum depression. We know that a lot of chemicals were involved in postpartum depression, and she couldn't form bond with her newborn child. She had rejection. Also, she had guilt. She had negativity. She had reduced life interest. She was thinking that I was a horrible mother. I reject my child. I don't want my child. So there were a lot of uh, depressive elements in her. And I treated these patients, a patient, even though she was on SSRIs, antidepressants, she had persistent depression for more than 4 months. So once we started treating her with EMDR, gradually her negativity dropped. She was able to form a bond with her newborn, and her she started experiencing positivity, her reduced life interest diminished, and gradually she was moving away from her postpartum depression. So this is one of the impressive case studies, but I would say that this is one and only patient I treated who was suffering from postpartum depression and used EMDR. And EMDR is very successful in treating borderline personality disorder. I have treated several patients with borderline personality disorder who had unstable emotions, manipulative behavior, impulsivity, and they were having suicidal thoughts. In Toronto, in Newmarket, I met Dr. Sherry Van Dijek. She's a DBT specialist, and I exchanged ideas with her. She also agreed uh, we can use EMDR because it has a DBT component. And EMDR is effective in post-traumatic embitterment disorder. Post-traumatic embitterment disorder was discovered by Professor Michael Linden of the Berlin University. He did a lot of research after the unification of Germany, especially the elderly population in East Germany. They had adjustment problems. After the unification, they had certain bitterment towards the system, guilt feeling, difficulty difficulty in adapting to their new social situation, and it was like an adjustment disorder. I spoke with Dr. Michael Linden and explained about the EMDR and its efficacy, and Dr. Michael Linden agreed using EMDR in post-traumatic embitterment disorder. Also, I use EMDR and meditation because in Buddhist meditation, there's a form of meditation called Kasina meditation. It has certain bilateral stimulation. And if you can combine bilateral eye movements, EMDR, and breath meditation, it gives a lot of positive results, especially in breath meditation. It gives a lot of oxygen to the patient's brain, and also it brings the person to the present moment. So using EMDR, also we gain a lot of positive outcomes. So EMDR and meditation, it's a very powerful mode that that can be used to treat patients with trauma, depression, and addiction. And I would like to say that I'm doing some presentations and training some students in trauma to face the Ukrainian war. I have delivered lectures at the Vinnytsia National Medical University, Ukraine, and there I highlighted the importance of EMDR and to use EMDR as a psychological first aid for the combatants who are in the battle front. So this ends my presentation, and thank you so much. And one more time, I would like to extend my thanks to EMDR Sri Lankan Association. Thank you very much.